Thank you so much for this interview. With us today, Dr. Varduhi Petrosyan, Dean at the American University of Armenia and Professor of Turpanjian School of Public Health, and Dr. Vahe Khachadourian, Epidemiologist, Assistant Professor of Turpanjian School of Public Health of AUA. Good morning and good afternoon, and thank you for joining us. My first question to you, how are you and how are you feeling?
We're doing fine. Thanks for asking, and thank you for having us.
You are healthy. That's the most important thing.
Yeah,
yes.
We try to stay healthy.
Okay. I want to start our conversation by asking you, do you know how many cases, how many positive cases have been identified to the date in Armenia?
Yeah, as of today, we have 136 cases, out of which 112 have been related to two separate occasions, which is about 83% of total cases. And we have the following dynamic in the last 4 days: 16, then it jumped to 33, and then 32, and yesterday it was 26 newly identified cases.
Can you tell us what's the spread of the disease as of today? How fast the disease is spreading?
It depends on how you look at the number of cases in Armenia. I mean, if you look at just the absolute numbers, of course, we had our first case, confirmed case, in 1st of March, I believe, and then of course, as of today, we have 136 cases. I mean, it's kind of straightforward to calculate on how number of cases has increased over these days. But the important fact here is that the most of the cases, as Varduhi already mentioned, is that it's related to it's coming from out of two clusters. So I think that's important, which is an indication that I think the disease and its spread is still under control in Armenia. So we don't really have that many sporadic cases throughout the country.
And how does the disease affect daily life in Armenia? By that I mean, are there any closures? What the situation is Yerevan? More specifically, what the situation is outside of Yerevan in more rural areas? And finally, how does the Armenians taking this situation? What's the reaction to the population?
On March 16, Armenia announced as an emergency situation until April 14th. And of course, the purpose has been to introduce social distancing to make sure that we don't spread the disease. And particularly, there are significant efforts to protect the vulnerable groups of the population that are considered as a risk group for this disease. Those are, our citizens who have higher age, those with certain chronic conditions. So we try to make sure that they are protected, and the government tried to make sure that there are no big gatherings up to 20 people, and if the number is more than 20 people, then the government strongly advises not to have those events, meetings, and many places have shut down. The classes are canceled. Kindergartens, schools, universities either are not working or they switch to online teaching. For example, AUA is completely teaching online. Schools in Armenia tried to switch to online, and I have to say that the Ministry of Education, in collaboration with the public TV and private companies that provide internet connection, are making arrangements to have access to even people who are living in villages to have access to internet and TV, so that the classes are aired on TV and the videos are available on YouTube without any charge to the users. So the theaters, cinemas, everything is closed. No entertainment places are open. To make sure that people do not get together in big groups.
Another very important question that I want to ask you: the government response, not only in terms of what you just described, but most importantly, in terms of number one, testing, and number two, the hospitals and healthcare professional preparedness. And number three, it's an issue that we are facing here in the United States, is a lack of protective gear, protective equipment for the doctors and nurses, and not enough beds for an emergency treatment in case if the disease spreads rapidly. What's the situation there? What kind of prognosis can you give us?
I have to say all these preventive measures have been taken by the government to make sure that we spread the disease over time and we don't have a huge peak that is beyond the capacity of our healthcare system. That's why these measures, the protective and preventive measures, are helping Armenia to have our sick people gradually so that we don't overwhelm the system. But of course, the Ministry of Health, in collaboration with the government of Armenia, they tried to take specific measures. They started working on this in January. They translated and adopted the treatment plan suggested by the World Health Organization and a few other documents for infection control, making sure that the hospitals are in proper shape and healthcare providers are prepared for this. Of course, this is a huge amount of work in a very short period of time, but the fact that we were able to prevent the first case and then the second case came after 10 days from the first case. So these were all measures that helped the country to slow down the attack of the disease. And I have to say that we had a team from the World Health Organization who came to Armenia recently, very recently, a few days ago, to assess how the country got ready for this big challenge. And their feedback was pretty positive. They were impressed with the work that has been done in Armenia and the work that has been done in the North Infectious Disease Center, the clinic that is separated only to have patients who have the new coronavirus.
There are, of course, different, how do you say, ranking systems that evaluate countries' preparedness for this similar situations. And there was one that was actually conducted by the Johns Hopkins University, which I believe ranked Armenia as number 44, if I remember correctly, and which is actually pretty good if you consider the amount of public budget that receives the healthcare system. And I think Armenia has lived up to that expectations in a sense that they have been very well prepared, as what we already highlighted. I mean, the Ministry of Health and all the other authorities related to healthcare system, they have done everything to prepare the healthcare system in a sense to try to, even they have tried to increase the capacity of the healthcare system if the worst case happens. So for worse scenarios, and I think the contact tracing and all those efforts that the health authorities have undertaken, those are of course important measures in trying to flatten the curve and keep the number of cases well below the maximum healthcare capacity.
I would like also to add, you asked about testing and its availability. The Ministry of Health obtained the tests pretty early, and currently Armenia has enough tests, but they do selective testing. There should be some symptoms and also epidemiological indications to run the testing so far. And all those who were diagnosed with having the new coronavirus were isolated in the hospital. And of course, if the number of cases goes up, then the isolation approach will change. according to the guidelines, and there will be another facility allocated for separating those identified cases who do not, almost not have symptoms of, or have very mild symptoms. For example, 1 day or 2 days of fever, and then everything is pretty regular, but we have to wait until they are virus free so that they do not spread the virus to other community members. Another thing that I would like to highlight here is about the responsiveness of the government. We try to provide some suggestions on what else could be done to improve the situation, or what other public health measures could be used. And whenever we came up with suggestions, I think the government has been quite responsive. Sometimes we were impressed. For example, we were concerned that some of the public transportation was crowded. Immediately that evening, we heard that the government made a decision that they would very closely monitor the public transportation so that there is no crowding, so that there is the risk is minimized to transfer the disease within the community.
Just listening to you and thinking about the government response, I mean, how would you grade it? Like from 1 to 10, what is it that what are specific things they can do to better respond to this crisis?
You know, it's very difficult to put a number there. When we talk about it, maybe we sounded very rosy. Of course, this is a very challenging and unusual situation, and we're not saying that the government in Armenia works without any mistakes. Probably there are some things that could be improved, but whenever we come up with a suggestion, we see an opportunity to improve something. Believe me, we find ways to share our opinion, because several of AUA graduates work in the current government, particularly the Ministry of Health, and we are in constant contact with them. For example, our graduates have had some brainstorming sessions to come up suggestions from the international experience, what else could be done in Armenia. And we created a list, and we communicated that to the government officials with the hope that they would address those concerns and would move forward. For example, we have been thinking about how to identify vulnerable groups and what kind of support to demonstrate to them, because right now they took already some efforts. For example, the pension. Previously, some of our older citizens would go to the post offices to receive their pension. Right now, post offices are delivering the pension to them. There are organizations such as the Armenian Red Cross is helping the Ministry of Social Protection to provide care and attention to those older citizens who live alone, with food packages and other things that are necessary. These days, there are many volunteers, thousands of volunteers who expressed willingness to provide their own support, help to, particularly with the vulnerable groups of the population. We heard yesterday that they are working on finding an IT solution to tracing and mapping the vulnerable groups of people. We, on our own, we're looking at the international experience to see what kind of public health interventions could be developed based on this available mapping of vulnerable people. Would you like to add?
So yeah, I just want to echo with what Varduhi already mentioned, that it's really difficult to give a grade and evaluate, especially at at this point, because this is probably not the end of the pandemic and the challenge globally and for Armenia. I mean, it's too soon probably. But what I can say that Armenia has done pretty well. probably there are areas that for improvement, especially that even the best of the best countries, they're also learning. You know, it's kind of an unparalleled challenge, and that's kind of a new and even the highly ranked countries in terms of preparedness, they are still learning from their own mistakes and as well as others' experience. But what I want to highlight here, which is I think very important, that this is not really one person's fight. I mean, you cannot entirely rely on the government. I mean, even if the government does a perfect job, this challenge cannot be overcome without participation of the community, of individuals, and all professional organizations, different parties. I think individual, absolutely businesses. I mean, it's really it requires a collaborative and supportive environment and work. I mean, starting from individuals' responsibility and going up and up and up, and including the government. So I think the final evaluation of Armenia's response should take into account all those players and how they keep up to stay on top of this challenge.
Armenians are, we are very communal people. We like to gather together, we like to hug, we like to touch, we like to shake hands. How is the social distancing working in Armenia? Is it something that people follow, or do they follow government recommendations? You mentioned the community involvement. What's the level of community involvement? What's the level of involvement of regular citizens? What's the level of involvement of nonprofits? And particularly AUA School of Public Health, what was their role specifically in supporting the government's efforts?
On some aspects, we are doing pretty well. As I mentioned, when the Ministry of Health announced the need for volunteers, like in 2 hours or so, in a couple of hours, the number reached 2,000 volunteers, and they stopped collecting information on volunteers because that was more than enough. On the other hand, when we talk about social distancing and, if you go out, if you have to go out, then keep about 2 meters or 6 feet distance between each other. That has been quite challenging. For example, if you go to a store, you might see people in a line and they stand pretty close to each other. So that has been a bit challenging. The government tries to send out messages, develop different videos on how to do that, what it means.
I would say that the engagement of the communities and especially the public health professionals have been very good and very high, and that's something that we are very happy to see in Armenia.
Currently, we have the students of the public health program at AUA volunteering in the Ministry of Health. As I mentioned, we have held brainstorming sessions with our graduates, and we shared all those messages with the Ministry of Health. Our graduates from different programs at AUA are working in the Ministry of Health and other branches and helping with evidence-based decision-making. 2 of the deputy ministers of health are graduates from AUA, one from the LLM program, the other one from our Master of Public Health program. So that's how we try to contribute. And also many of our alumni are translating the existing evidence, information from recently published scientific articles, translating into Armenian and spreading the word, not only among the general population, but also among the professional public. We try to also translate materials on personal protective equipment, developed multiple posters and shared with the Ministry of Health so that they could educate the health providers, nurses, and physicians who are working immediately with people who have the infections.
We spoke about this a little bit, but I want to go a little bit deeper into this topic about the rural areas and also Artsakh. You know, in Yerevan, there is, you know, public information campaign, there are hospitals, it's a denser community when people can rely on each other. You know, theoretically speaking, what happens to the person in a rural village in Armenia or in Artsakh that feels the symptoms or, you know, has a positive test? How do they get care? What happens to them?
For example, one of the recently identified cases was from Mary. The person traveled in Italy and as a result was infected with this new coronavirus. The person, because there was epidemiological, you know, factors behind it, he or she, I don't know, immediately was transported to Yerevan because testing is available in Yerevan because you need to have a sophisticated lab capacity, and the close contacts were identified and isolated. They receive information on what it means, how to do, what not to do. So we have at least examples that when it happens in rural areas of Armenia, there are solutions. Of course, in terms of internet connection, it's much more widespread in Yerevan, but these days it's very widespread. And also, as I mentioned, the providers of internet connection also got united and they promised to provide free access, particularly for internet for educational purposes. But the public awareness raising videos are available on the public TV. Armenian citizens have universal coverage. You also asked about Artsakh. You know, Artsakh closely follows the guidelines that are coming out, for example, from the Ministry of Health in Armenia. They also tried to minimize the movement between Armenia and Artsakh so that, you know, we know that there are confirmed cases in Armenia. We don't want them to move to Artsakh and also, you know, spread the virus there.
I know prior to this interview, we had a little chat and you said that it's very difficult to have any prognosis as to how long this disease will last in Armenia. But, you know, for a layperson like me and many others, I think it's a kind of a common sense question. Is there any comment or anything, any kind of foresight you can give us? What's the trajectory? What do you expect? How worse it's going to get? What will happen?
Well, it's really difficult to comment on the trajectory, but because it also, you know, it depends on the actions that the governments and the societies are taking. So that really depends on those things, and that's the reason that we have different situations in different countries because of the different type of response that they, you know, and measures that they take. So. I mean, one thing is that, for example, if a vaccination becomes available, especially to a big portion of the population, I mean, that would be one way and one scenario where this epidemic and pandemic will come to an end. The other approaches is probably, you know, that once a big portion of the population develops natural immunity, that would eventually develop a concept known as herd immunity, which is basically if a big portion of the population is immune to this disease, then that would also give and protection to the other vulnerable population who do not necessarily have the immunity against this disease. And of course, you know, the last one is that, you know, going on and off with our measures until something comes up, such as vaccination. But I also want to mention about the experience that we had with SARS, that it started again in China in 2003, or maybe not started, but at least the first case was discovered in China. But for example, that was also a very huge problem. It has even higher mortality, probably 10 times higher mortality than COVID-19. It has a mortality rate of about 10%. But that, that SARS infection actually stopped, and we haven't really had any cases in the past few years. There have been a few incidents because of the incidents in the different laboratories in different countries, but those have been the only cases that have happened. But after that, we haven't really had any cases. So there are all these options, but we don't really know what would happen. I mean, that's a question that everyone is interested to know the answer, but it's very difficult to say which one would be the case with a high level of certainty.
My final question, probably the most important: what can diaspora do? How can we help?
Okay, I will probably start, and I'll ask Vahe to continue. First of all, we have many faculty members from the US, and we constantly ask them to share with us any evidence that could help us. So they could help with evidence, evidence-based decision-making, with sharing some of their successful experiences. I know that there recently the Commissioner of Diaspora, they have also arranged shipment of certain medical materials, disinfectants, personal protective equipment, and other things that would be necessary for this condition. A few days ago, they were shipped to Armenia. So, for example, today I also received calls from friends living outside of Armenia because they heard about this fundraising event organized by the Ministry of Finance and Ministry of Health, and they were asking for the banking numbers so that they could make contributions from abroad. And we tried to share that information with a wider community so that anyone who is interested in contributing to fight this virus can make their contribution to this special account for this situation.
Yeah, and I think that I'll add also that the challenge, I think, can be divided into two phases. One is the health challenge that we currently are facing, but I think not less important and probably not less severe would be also the social and economic challenge. And on top of the expertise and this evidence-based approaches that experts from diaspora can share, I think diaspora have a very big potential when it comes to helping Armenian economy to overcome all this kind of the down that we will probably see because of this coronavirus pandemic all over the world. I think that's when the diaspora can be very effective.
I want to thank you very much for taking time and giving us very informative interview. I'm sure our viewers are extremely interested and worried about what's going on in Armenia. And thanks to your efforts, we know now that every effort is being made to make sure that Armenians are safe and the country is doing well. We would like to continue this conversation. Perhaps we can set up another interview in a few weeks' time to get an update. Thank you so much, and most importantly, stay safe.
Thank you. Stay safe and healthy.